Hi everyone. Um, it's Philip de Sharma here. I live in Waterfall, KwaZulu-Natal, South Africa. I needed to make this video because I kind of find it difficult to navigate all the elements of this coronavirus, SARS-CoV-2, whatever else. But my main focus today is essentially to share my experience in terms of the tobacco ban. When it was announced that tobacco would be banned, selling of tobacco would be banned, I stocked up on enough tobacco to see me through the ban in a couple of days. I'm a pipe smoker. I've been a pipe smoker for over 40 years. I need to place this in context about my experience with the tobacco ban. About just over 5 years ago, I was diagnosed with a compromised gallbladder. According to the surgeon at Hillcrest Hospital in KwaZulu-Natal, Dr. Wessels, the only way that I could heal myself would be to have my gallbladder removed. At the time, I knew very little about gallbladders. I knew very little about so many things. The decision I made, even though I was jaundiced, I was suffering from quite a lot of pain. I had a blocked common bile duct, and I was in a pretty poor state. At the time, I decided no, and this was based on my understanding of other people that have had their gallbladders removed and have suffered consequences thereafter. So I took my health issues at hand. By the way, I've got scans and blood tests to show the absolutely poor liver function and the state of my gallbladder. Anyway, the only reason I'm bringing this up is because through this experience of stopping smoking, I took a bit of a path that has made me very, very sick. I am better now, but I need to share this experience. The main reason for sharing it is that I understand some research has been done about the impact of SARS-CoV-2 on smokers. I have written to the person doing the research in France. I have not received a reply yet. Let's start at the beginning. After about 4 days after the 2-week ban, I ran out of tobacco and I was unable to get tobacco. So I decided that I would go take a walk to the local mall, to the Dis-Chem shop, and purchase some nicotine patches. These patches I put on my abdomen. After the first day, I noticed that the area around the patch and underneath the patch was relatively pink. At the time, I was suffering badly from headaches. I have got an old neck injury, which does sometimes cause headaches. But at this time, because of the lockdown, I was unable to go and see the chiropractor who would normally massage my neck. And that would put things back into context for a month or more. Anyway, I put the patch on the first day, slightly pink when I removed it. The next day, a little more pink, slightly welted. By the end of the week, the headaches were gone, but I was feeling so dizzy. After about 7 days of using the patches, the one day I was getting up from my desk, I felt so dizzy. I sat down again and my nose started bleeding. And it bled for about a day, on and off. Only later did I discover that one of the side effects of the patches is high blood pressure. I've never suffered from high blood pressure. Anyway, So obviously I stopped the patches, and I spent another 2 days trying to get myself back into shape, but the headaches wouldn't go away. I was becoming increasingly agitated. After about just after about 3 4 days, I decided now I'd go back to the mall to Dischem, and I'd purchase some Nicorette tablets. These I started chewing maybe a gum. It's a 2 milligram nicotine tablet. I started to chew a gum every 2 hours, every 3 hours or so. And the headache started to relieve. But what I noticed was that after about 4 or 5 days, my digestive system was being very compromised. As I said to you, I had a gallbladder condition 5 years ago, which I've completely reversed without any medication, actually going contrary to a lot of doctors' opinions and doctors' recommendations. I have two methods of ensuring my self-help medication works. I look at the color of my stools, and that gives me a good indication. And I use urine checks, which are, where are they? Yeah, they are. Urine checks. They pee sticks. So what happens is you can't see that. Why is it? Anyway, you can't see. What happens is you dip that in your pee, and you can tell what's going on. As soon as I started not to feel well, I dipped it in, and I saw the bilirubin. I actually started to notice my eyes were starting to turn yellow. I was starting to become jaundiced again. The pH had gone up to between 6.5 and 7. It should be around 5. And the SG had gone up. I do have quite a lot of things that have helped me to manage my condition, but that's a complete other video. But just to give you an example, there's the zinc. There's some digestive enzymes. There's some vitamin D2, D3. Obviously, multivitamins, selenium, quercetin, and obviously omega 3s. What else? Baroccas. Ecstasy, boosting vitamin C, pure vitamin C. Anyway, and probably the most important is betaine, which is how I managed to turn my condition around once I discovered that. I discovered that when I was getting my liver function back into shape, I discovered that I don't have heartburn because I've got too high of stomach acid. So all the years are being recommended antacids, and even highly recommended that I take PPIs, protein pump inhibitors, which on research also has negative effects on the body. Anyway, so once I discovered that, and then I found out that the problem wasn't high stomach acid, but low stomach acid. And this betaine, which I can go into in more detail, was the godsend. But now to get back to the Nicorette gums. I took a walk to the Dischem and I purchased 105 gums of 2 milligrams. And as I said to you, when I went to purchase them, I was extremely agitated. I had to stand in line, social distancing with my mask on, which I find deprives me of oxygen. and really, really isn't good because I start to feel more and more lightheaded as I spend more and more time with the mask on. So I try and avoid places where I have to wear a mask. Um, when I got into the door, they handed me a little disc, and this was supposedly to control the number of people in the pharmacy. I refused to take the disc. I was agitated. I just dismissed the security, walked in. I was on a mission. The store manager came up to me, the Dischem store manager, and said that I had to take a disc. And I asked him for what legislation. And he says, no, we've got to control this. I said, well, it's you that have to control it. I don't have to be part of your control system. And things escalated a little bit. And I found myself taking on a stance of wanting to hit him, which is very, very out of character. Anyway, my main message is this cigarette or tobacco ban, because I don't smoke cigarettes, has caused a lot of pain and suffering in my life. I know other people have suffered as well, and my heart goes out to those who maybe don't understand their bodies as well as I do and can't analyze what it is, or go and get medical advice for whatever, and land up in a more dire situation than they could have been. The ban on cigarettes and the research, I understand the research. It's got to be double blind, placebo controlled, and whatever. And they're testing for nicotine as a substance. But nicotine as a substance isn't the issue. It's the delivery method. If you smoke cigarettes, I don't know what they've added into cigarettes, especially those that are now available on the black market. Talking to friends and that, they say it's absolutely crappy cigarettes. I wouldn't know. I'm fortunate now. I have managed to get myself good old Fox. And yeah, and I'm feeling a lot better and a lot stronger. And I just wanted to point out to those who are doing research on the impact of smoking on COVID-19 or SARS-CoV-2 or whatever, that the real issue is not the nicotine on the ACE2 receptors or whatever biological function they're talking about. There's something more to it than that. And I place that in front of you with the thought that less than 70 years ago, or just over 70 years ago, in 1949, the Nobel Prize for Medicine was awarded to, well, you can look it up, 1949, Nobel Prize for Medicine, was awarded to somebody for the procedure of a frontal lobotomy. Now, that frontal lobotomy is where they stick a sharp blade behind your eye and they sever part of your brain. And that at the time was deemed to be the best medical intervention, to such a point that you get a Nobel Prize for that. Here in 2020, we now have got so much controversial information about what the virus is. They go and they look at the genetic mutations, they look at the history, and they've got ways of looking that it's been spliced. And some people say it's a standard virus, and others say, no, it's a virus that's got all sorts of elements because they can tell by the genetic sequence. And I know nothing about all that. I know absolutely nothing. I just hear, and I hear people having different points of view. Some people saying it's like any other flu virus, maybe a bit more virulent by virtue of the R naught and the fact that people can be asymptomatic and still be carriers, and all sorts of things. I have no idea what that is. And if I had to have a particular point of view on that, it would have to be on faith, blind belief. This brings me to this point. The blind belief in the science is what I'm going against now. And in context of smoking, pipe smoking, I'm going against. Because I urge, if there is to be research, let's make the research real. Let's not go to the standard methodology of total reductionist thinking, right down to the molecule, to the nicotine molecule, and looking at it in terms of receptor sites and whatever else. Let's look at the real environment. It's all about the environment. We can't, just like the spread of SARS-CoV-2. If you look at the number of people that have suffered greatly, it's those people that have been in confined indoor spaces where you have several people or many people that are sick and getting increasingly sick because the viral load, it's like dust particles. If everybody's breathing in and out this virus, the environment gets loaded. If you look at pictures of hospitals looking after TB patients back in the 1950s, you'll see that one of the biggest cures or one of the biggest remedies was to put the patients outside on their beds. Not only is that good because they get a good dose of vitamin D, but it also limits the amount of spread. It is my understanding that this virus can attach itself to certain parts of the body, certain whatever blood molecules. By the way, the understanding that it's actually like an altitude sickness just lets me think that they've got no idea on how this virus works. Some people say it's this form, and some people say it's another form, and all sorts of theories. But the best theory that I can understand is the fact that it basically hijacks the body's ability to circulate oxygenated blood, or it hijacks the that ability, and then obviously as your oxygen saturation level diminish, you land up in a more and more critical situation. But if you get, let's say, like, I don't know, one virus, then your body can fight that. So it's an environment. Put people in an environment where lots of people have got some of the virus, it just grows exponentially. That's the bottom line. Keep people in fresh air, in good sunlight, keep people working. I'm very sad about South Africa. I see all the hardship, all the pain, all the difficulties that we are experiencing here. I can imagine those who have suffered from not being able to get cigarettes or other conditions, and the social economic conditions that so many people live in, and the overcrowding, which will then just go and become a hotspot for coronavirus. This is not a unique disease or a unique pandemic. Our reactions to it are unique. And in every way, it's almost, if you, to my way of thinking, if you could design a way of making people less able to cope, you couldn't have designed any other better method in this crisis than the lockdown. You force people not to be able to go out and earn their living. You force people, well, they live in crowded, unsanitary conditions where food scarcity and all these, I don't know if they're true or not, situations where food parcels have been stolen, where NGOs and faith-based parcel distributors have been prevented from distributing parcels. All these things go deeply to my heart, deeply to that humanness that we are losing. As I was saying, there could have been no method that would promote or elevate the adverse impact on people than the lockdown. No virus could ever have caused so much damage. No virus could ever have disrupted so many lives, not only in South Africa, but all over the world. All the debates don't seem to be doing much. We now need to look at the way that we're going to fix these problems, and we need to hold the leaders accountable, not out of retribution, not out of any other thing, but to hold them accountable such that their misdeeds and their actions, that they be responsible for them, so that if the political system is to work and we don't have too many food riots or just pure anarchy in this country, such that they can not be re-elected to positions of power. And furthermore, working from a pretty mundane base, we need to ensure that the situation that we find ourselves in with the COVID Council and the difference between a state of emergency and a state of disaster, that the legislative mechanisms come into effect to prevent people from taking such draconian measures unilaterally, without intervention, without any public scrutiny or even legal oversight of how this can happen. We are, as far as our constitution is concerned, a free people, but this isn't free. I, fortunately, have only suffered by virtue of my inability to get tobacco and two wrong decisions of using nicotine patches and chewing gum. Fortunately, I knew how to handle it. My life is pretty ordinary, and I've not suffered that much, but I can imagine the suffering all over South Africa and all over the world, and it makes me very sad that leaders are getting away with such stupid, irresponsible, badly thought out, unnuanced, draconian methods to control society, all for, as far as I can tell, a virus that doesn't have that much of a devastating effect on anybody in the right environment. Thank you for listening. I really do hope and trust that you are well, and that you take care, and that you can add a public voice to this very, very difficult and unnecessary harm on humanity. Thank you.